Hello, my name is Dr. Sabrina Fabi. I'm a board-certified dermatologist, and I'm here today with our patient Michelle, who's in her late 20s, but patients come in usually in their early 30s as well as in their 40s, 50s, or 60s for a procedure we're doing today called Tumescent Liposculpture, which was invented by a board-certified dermatologist here in actual Southern California. And so, Michelle, what's bringing you in?
I eat healthy. I go to the gym, but there's always just a layer of fat that I can't get rid of. I've done everything I could, and I think this is what I want to do. It seems appealing just because there is not a lot of downtime, not a lot of recovery time, and I don't have to go under, so that was the biggest factor in me making my decision.
And so when are you planning on going back to work?
I'm going back to work in 2 days.
Wonderful. And so that's commonly what we're seeing. It's a procedure called Tumescent Liposculpture. And so different from the usual liposuction that classically use general anesthesia and large cannulas, sometimes the size of Sharpie pens essentially, we're focused and changed it to a technology or a treatment that really uses these small cannulas, micro cannulas that are the size of Q-tips. And because of that, it doesn't induce a lot of trauma for the patient, and therefore they don't feel so beat up after the procedure. They get up right from the table and are able to resume daily activity. Now, usually we give a little bit of medication so that they're comfortable and lightly sedated, but it doesn't require general anesthesia, which is why they can essentially walk immediately from the OR table back into the next room. And so we're essentially going to mark her now, take her back into our OR suite. We have 2 accredited OR rooms here in our practice, just adjacent to the clinic, making it very easy for our patients. And then tomorrow she'll be coming back just for one pre-op, post-op visit. And from there, she's going to have really no bruising, no downtime, resuming activity, and basically back to work in 2 days, which is really nice about Tumescent Liposculpture. So here we are, and we're essentially just taking off a little bit of fat that you can see in the tubing, nice and yellow coming out, no real sign of blood or anything like that. The patient is pretty much awake, and we'll be talking to her in a moment. And so this is how simple it is. We're using cannulas that are essentially this small, so not the size of a large pen, which classically were used under general anesthesia. She's locally numbed through here, and that serves as the medicine. She's barely on any medication IV, just a little light sedation, just so she's comfortable. But if we talk to her, you'll find out that she's doing just fine. So Michelle, how are you doing?
I'm doing great.
Wonderful. And are you comfortable? Any discomfort at all?
No, it's totally fine. Totally fine.
Wonderful. And so that's pretty much it. And so this will take about 2 hours to do today. And then she'll be basically getting off the table and walking into the post-op area. And tomorrow she'll be resuming her daily activity, can go back to work. And as early as tomorrow, but I generally encourage my patients just to take the day off, not be stoic. And so she's going back to work in 2 days.
Okay, I'm back to see Dr. Fabi today. This is 1 day post-op, post-lipo. I feel amazing. There was mild discomfort yesterday. Took a Tylenol, felt great after that. Slept 8 hours, and I could have gone back to work today, but I'll be going back tomorrow. And I'm very happy with the results. I know there's some swelling, but I already see a waist, which was something I never had, and I'm very happy with Dr. Fabi.